What is snoring? Snoring is noisy breathing while you sleep. It's a common condition that can affect anyone, although it happens more often in men and people who are overweight. Snoring tends to get worse with age. Snoring can itself be a symptom of a health problem like obstructive sleep apnea. If you snore often or very loudly, you might need medical help so you and your loved ones can get a good night's sleep. Snoring causes. Snoring happens when the flow of air through your mouth and nose is blocked. Blocked nasal airways. Some people snore only during allergy season or when they have a sinus infection. Problems in your nose such as a deviated septum, when the wall that separates one nostril from the other is off-center, or nasal polyps can also block your airways. Poor muscle tone in your throat and tongue. Throat and tongue muscles can be too relaxed, which allows them to collapse into your airway. Bulky throat tissue. Being overweight can cause this. Some children have large tonsils and adenoids that make them snore. Long soft palate and/or uvula. A long soft palate or a long uvula, the dangling tissue in the back of your mouth, can narrow the opening from your nose to your throat. When you breathe, this causes them to vibrate and bump against one another, and your airway becomes blocked. Alcohol and drug use. Drinking alcohol or taking muscle relaxers can also make your tongue and throat muscles relax too much. Sleep position. Sleeping on your back can make you snore. Sleep deprivation. Your throat muscles might relax too much if you're not getting enough sleep. Snoring diagnosis and treatment. Your partner might be the person who tells you that you snore. Your doctor will ask both of you about your symptoms. Your doctor will also ask about your medical history and do a physical exam to look for things that could block your airways, like a deviated septum or swollen tonsils. They might also give you some tests. Imaging tests. An X-ray, MRI scan, or CT scan can look for problems in your airways. Sleep study. You might need to have a machine monitor your sleep while you're at home or spend the night in a lab for a test called polysomnography. It will measure things like your heart rate, breathing, and brain activity while you sleep. Treatments for snoring include lifestyle changes. Your doctor might tell you to lose weight or stop drinking alcohol before bed. Oral appliances. You wear a small plastic device in your mouth while you sleep. It keeps your airways open by moving your jaw or tongue. Surgery. Several kinds of procedures can help stop snoring. Your doctor might remove or shrink tissues in your throat or make your soft palate stiffer. CPAP. A continuous positive airway pressure machine treats sleep apnea and might reduce snoring by blowing air into your airways while you sleep. Home remedies to stop snoring. Try these other solutions to get a good night's sleep. Sleep on your side, not your back. Raise the head of your bed a few inches. Use elastic strips that stick to the bridge of your nose to widen your nostrils. Use decongestants to open your airways. Don't use them for more than 3 days without talking to your doctor. Stick to a sleep schedule. Snoring complications. Snoring doesn't seem to have complications. But sleep apnea can cause problems, including frequent waking from sleep, even though you may not realize it. Light sleeping. Waking up so many times a night interferes with your normal pattern of sleep, causing you to spend more time in light sleep than in more restorative, deeper sleep. Strain on your heart. Long-term obstructive sleep apnea often raises blood pressure and may make your heart get bigger, with higher risks of heart attack and stroke. Poor night's sleep. This makes you sleepy during the day, can interfere with your quality of life, and can make car accidents more likely. Natural snoring remedies. Lose some weight. People who are overweight are 2 times more likely to snore than those who aren't. The reason is simple: overweight people carry extra fat around their necks, which narrows their airways and causes them to snore. So lose a couple of pounds and lose your noisy nighttime companion. Switching up your diet, getting some exercise and ironically enough sleep will help you lose weight. Change your sleeping position. Sleeping on your back can cause your airways to become blocked or narrowed. If you notice that you snore while sleeping on your back, it is time to switch up your sleeping position. Sleeping on your side is usually recommended. Old habits die hard, so the odds are that as you drift deeper into sleep you'd roll onto your back again. The fix? Invest in a body pillow. A body pillow will help you maintain sleeping on your side. Another mean old trick is sewing tennis balls onto the back of your pajamas. Cut down on alcohol and cigarettes. If you drink alcohol habitually, especially before bed, that might be the cause of your snoring. Drinking alcohol a couple of hours before you go to bed relaxes your throat muscles, causing you to snore. Regular smokers are also likely to snore. Smoking irritates your throat tissues, leading to inflammation that results in snores. Drink more water. Staying hydrated is always a good idea, particularly for snorers. Dehydration leads to mucus forming in your nose, which could make you snore. Drinking about 3.7 liters of water for men and about 2.7 liters of water for women is highly recommended. Get a couple of humidifiers for your room. While dry air might not be the main cause of your snoring, it can certainly aggravate it. So get a couple of humidifiers to keep the air in your room nice and moist. The added moisture in the air will help lubricate your throat, making it easier for air to flow in and out without causing any noisy vibrations. Work out your tongue and throat muscles. You snore when your tongue and throat muscles are too relaxed. Strengthening them would help you stop. There are a couple of exercises which could help you strengthen. You do this. A great and easy hack to get some throat exercise in is singing. So throw yourself a concert in the shower or your car. Your partner or roommates might find it annoying, but it'll be less annoying than your snoring. To work out your tongue, place the tip of your tongue behind the top of your teeth and slide it back and forth for a couple of minutes a day. Examine your diet and cut down on inflammatory food. Dairy and gluten products are well-known culprits for causing tissues in your nose and throat to become inflamed. You don't have to completely cut out that yummy glass of chocolate milk you have every day. Pick out some days where you have some plain tea instead, and don't have it too soon before bed. Get some steam in. Use a facial steam bowl to open up your airways just before you go to bed. This comes in especially handy if a stuffy nose from a cold or allergies is the cause of your snoring. First, fill a large bowl with hot water. Next, drop your head over it. Get close enough for the steam to do its job, but not too close so you don't get burned. Drape a towel over your head to lock in the moisture. Taking a warm bath or a hot shower also has the same effects. Get enough sleep. Exhaustion can relax your throat and tongue muscles and cause you to snore. It's important to get 7 to 9 hours of sleep every night. Ironically, sleeping pills and sedatives also have the same effect on your throat and tongue muscles. So if you have trouble sleeping, you might want to explore some natural remedies before reaching for those pills. Elevate your head while you sleep. If sleeping on your side instead of your back doesn't stop your snoring, you might need to prop up your head a little bit. This will ease breathing and open up your airways. Using a pillow or two should do the trick. You could also slightly the front of your bed by a couple of inches. Use a CPAP, continuous positive airway pressure, machine. If medically appropriate, wearing a pressurized air mask over your nose when you sleep can help keep your airway open. This treatment is often recommended to treat obstructive sleep apnea. Wear palatal implants. Also called the pillar procedure, this treatment involves injecting braided strands of polyester filament into your mouth's soft palate. This stiffens it to reduce snoring. Get up, uvulopalatal. This type of surgery tightens throat tissue in the hopes it will reduce snoring. Laser-assisted uvulopalatal LAP, which is sometimes more effective than UP, is also available. Radio frequency tissue ablation, somnoplasty. This new treatment uses low-intensity radio waves to shrink the tissue on your soft palate to reduce snoring.